Thank you. So as you know, the digital, the technology is now coming with a very big wave on the very big wave. So, but the hypertension is a key. Blood pressure is a key clinical indicator to be the risk factor for stroke, coronary artery disease, and heart failure, and also other organ damages. So, hypertension is a key factor indicator to link from the health to the disease. So, non-communicable disease, the cancer, and also other cardiovascular events are closely associated with the blood pressure variability. My concept is the blood pressure surge. The biggest surge trigger cardiovascular events, the hemorrhagic stroke and ischemic stroke, and also rupture of the plaque to trigger the coronary artery disease. So link various factors linked to the surge blood pressure. So environmental factors, the cold temperature or some the humidity or some hot temperature may affect to the body. So we can assess the stress of the environment by the blood pressure variability. And also the blood pressure, the variability consists of the different pressures with the different time phases. So overlapped and simultaneously occurred such as blood pressure surge. The biggest surge could be produced by the resonance. So resonance hypothesis is my background to use the digital hypertension into the clinical practice. So IoT, information communication technology, and also IoT, and also mobile health, and the using these device and the sensors, and also blood pressure change, that we can gather all the data with time series. So it could be we can identify which component affect the blood pressure change. So using the AI, we can speculate, we can predict, we can anticipate the event, cardiovascular event, when, where, and what the patient doing. It's a personal anticipation medicine. So time is now to use such a digital technology to predict cardiovascular events. So using the blood pressure change, blood pressure surge, it's our direction to of the hypertension, especially for digital hypertension. Yeah. So digital technology and telemedicine will be compensate and also increase the quality of the hypertension control. That means the further more extended the blood pressure reduction, which result in the more extended cardiovascular event reduction. So, but the doctors have a examination by 1 month, but the digital technology will link such a visit between the visit to visit. So using the digital technology, we can assess the patient, the time trend of the blood pressure, and also if we can advice using the AI or some application, the APP, to the good life modifications. So such a digital technology will increase the quality of the hypertension control. So this is the digital therapeutics. So we are now the first developed the very good, the effective application of the digital therapeutics, which reduce blood pressure. So it's now the initiation era of the digital therapeutics. So this technology will ICT technology increase the quality of the blood pressure control. But we are not so much familiar with such a technology because the older patients have the very not so familiar with using the APP or digital technology. So that's one of the important barrier of the how to introduce such a digital technology into the clinical practice. So we should penetrate digital technology into the clinical practice. So it's very important because we examine the patient within a very short term. So using the APP, this interactive the APP with the patient could store a lot of the information, personal information, and their patient characteristic, and also psychological factors, and also their behavior. That their characteristic store the APP and the transit to the doctors. So we can, using such a technology, we can conduct the patient examination of the personalized the therapeutics could be possible using such a technology. And also there are a lot of the combination of the therapeutics and the drugs, and also on non-pharmacological treatment, and the interactive with the patient, the behavior, and the patient, the characteristic. So all the information get stored together and getting together to be considered. So AI could be possible to instruct the best treatment based on the doctors and also previous clinical literature's evidence. So it should be the new areas. So the Western countries make a lot of the evidence. So evidence-based guidelines are now the mainstream of the clinical practice now. But the evidence is made in the Western countries, but the Asian have a characteristic. We are prone to the stroke and also the non-ischemic heart failure, and and also association with the hypertension is the steeper in Asia. Association between the cardiovascular events, stroke, and even coronary artery disease, blood pressure increase, the more powerful risk factor to the brain and the heart. So we need the Asian-specific evidence, which leads to the guidelines. So that's the motivation to make the Hope Asia network, because we need the experience and also evidence with the association with such a very good the network to make more precise and just adjusted the clinical practice to prevent cardiovascular events more effectively, especially for the Asian countries. That's our motivation. So first of all, we have 3 missions. First, we should know the evidence up until now. So we are writing a lot of papers. If you want more papers, especially focusing on the Asian characteristic of the management of hypertension and related disease to use the prevention and the treatment. And second is making the consensus. So with the Asian key opinion leaders, we should have some reached the consensus. So we release a consensus on some home blood pressure and everything, and also other management of hypertension aspect. And third, they are making conduct the studies to know the current status of blood pressure management using the home blood pressure. So we have 3 missions